So welcome everyone to the March Lake Highlands White Rock Democrats meeting. We've got a good agenda for today. We'll be doing a short meeting with Dr. Huang from the Dallas County Health and Human Services Department. He kind of heads things up, and you've seen him on the news, kind of keeping Dallas County up to date and giving recommendations to schools and everyone else in Dallas County. We also have our Commissioner, Theresa Daniel, who will be helping lead the questioning. She's put together a good amount of questions, and I think questions that'll be thought-provoking and give everyone some good things to think about. And, you know, of course, you can put questions in the chat area and wherever you like, or raise your hand using the little mechanism on the thing, or just, you know, raise your hand and I'll look for you and we'll let you ask some questions. After we get through about 45 minutes to an hour with Dr. Huang and Commissioner Daniel, we'll move into our general membership meeting. And in that meeting, we do have one order of business that we'll be talking about today and need a vote on from members, as we do have a replacement candidate for vice president. I was going to talk about this in the member meeting, but I can talk about it now. Unfortunately, Vice President Terry Hodge had to step down due to some other commitments. So we put out a call via email, social media, made a few phone calls to try and find a replacement. We know it would be hard to find someone as trustworthy and as competent as Representative Hodge, and also to follow up with what Scott Haddon had done. But we think we found a good candidate, and we'd like to take some nominations if there's anyone that would like to be nominated for that role before we put that person to the club for actual voting and nomination. And I'll let the cat out of the bag now, I guess. It's Kendall Scudder. So Kendall decided that it would be a good fit for him to help out with getting great guests and great speakers and great topics, and he's already got some really good ideas. And since he's in Lakewood and he's a member, you know, the board, I think, was enthusiastic about him coming aboard. So really excited about that, and we'll take a vote on that a little later and also ask for other nominations. And we're also looking for other positions. So we definitely would like some help on social media, on help with the website, help with merchandise, a few of those things. Also a precinct liaison is something that we've been looking for. So if you have any of those skills or interests, you know, just feel free to contact any of the board members or email admin@lhwrdemocrats.org, and we'll get you in touch and get some help. So on that note, we typically start the meeting with the Pledge of Allegiance. So this is also the pant check. We did have one member tell us one time that, hey, I didn't have my pants on, so I didn't stand up during the Pledge of Allegiance, but got a little flag behind me. Let's go ahead and do that real quick, and we'll get started. Pledge of Allegiance
to the flag of the United States of America and to the republic for which it stands, one nation, under God,
indivisible, with liberty and justice for all.
Great. Well, thank you, everyone. I'm going to go ahead and check in the meeting here, see if we have a commissioner on. Don't see her yet. So let's just open it up. You know, we can kind of talk about what we want to hear from the commissioner and the doctor and kind of precede our questions.
Before you start on the program, let me take a minute and just introduce Charlie Gearing, who's joined us here today.
Oh, thanks, Scott.
He's got a different interest, and so we can get that out of the way.
Okay.
Oh, Scott, you're so kind. Good morning, everyone, and hi, Brian. We messaged Brian a few weeks ago at one of the Fed's events, but it's great to meet you all. I am an attorney here in East Dallas, and my wife is also an attorney here in East Dallas. We live in Casa Linda, so not too far from y'all. But I filed last week, and I'm running for Congress against Lance Gooden in Congressional District 5. So
All right.
Great.
it's great to meet everybody, and I'm really excited to get to work with all of you and hopefully earn all of your votes and your support. So thank you so much. It's great to meet y'all.
Great. Welcome. Thanks, Scott, for introducing
Thank you.
Charles there. Also, do we have any other candidates on the call? I know we have a city council race coming up, and we've had Adam Basil Dua pop in and say hello. I know Scott has our District 10 councilman. When's that, Scott?
Thursday evening, 7:30.
Okay.
You should get an email. Be there.
Yes. And
We have a judge candidate down there.
I can't see everyone. Is that
Pamela.
Judge?
Well, I guess I'm a candidate. I guess I'm always a candidate.
You're a sitting judge, aren't you?
Yes. So yeah, hi everybody. I'm Pamela Luther, and I am a sitting judge, and I will run for re-election. That's for next year. The primary is next March. So yeah, and yeah, shout out to Casa Linda. I sure miss it. I used to live on Buckner Boulevard. So
Good to see
All
you,
right.
Judge Ron Mercer. So right off Buckner.
okay, great. I think I'm going to move back over more into like Highlands from Oak Cliff because that's where I'm from, number one. But my kids, I had 4 kids get married in 2020.
Wow.
Um,
You're broke now,
can you believe it? 2020. And so I think everybody's wanting to live there. And I've got some grandbabies on the way too. And everybody's, so I'm going to be close to all the grandbabies. So I can't really do it till next year, but I'm already looking at all the Lake Highlands realtor.com searches. So looking forward to being back there.
Come on back.
Yeah.
Can't wait. If I can afford it. I don't know if I can afford it anymore.
Well, you can afford a membership in our club. I know that.
There you go. That's good.
Dale, love it. Always promoting the club. Do we have any other candidates on the line?
We have several precinct chairs, and they survived a 4-hour meeting the other night. So congratulations to all the precinct chairs.
Yeah, definitely. Precinct chairs are what make this democratic operation go around. While we're waiting for the commissioner and our doctor, if you'd like to introduce yourself as a precinct chair and tell us a little bit about what you're doing to engage with Democrats in your community, love to hear from you. Give us some ideas.
Bill's been doing it about as long as I have. You're west of Central, right? Over in Park Cities, Bill?
You talking to me?
Yeah.
Oh yeah, I'm just north of Scott Haddon, so I'm in 2060.
Okay.
We've got Walnut Hill above and below it, between Audelia and White Rock Trail. It's a pretty big precinct because we've got like 2,600 voters, and I'm the only one. I think Scott can verify this, but we got some hardcore Republican pockets in this area. I think we're the only precinct that did not go blue.
No, yours and mine. Bill and I are the only red precinct still in Lake Highlands.
And we worked our tail off. So I can just tell you, it is hardcore. There's some areas in ours that it's hardcore, but we're making progress, and we're getting there, and we're gonna slay that dragon. But someday.
Bill, I have a question for you, and Scott as well. Has this been a change over the past few years, like a more of an influx of Republicans to these areas, or has it always been there?
No, I think it's getting closer to 50-50 in my area, and it was 80-20 Republicans.
Right.
Yeah, mine was 60-40 and is probably 55-45 now. I'm not the dominant party in my precinct. I have Mockingbird to Northwest Highway, Skillman to Abrams. And it's been a Republican for years, and it's been gerrymandered by Republicans once or twice.
So Mary, did your question go to more to how did it become more democratic as far as like people moving in or people's change of political?
No, it's more anecdotal than that. I mean, I've been in Lake Highlands for, I don't know, 25 years now, and it just seems more Republican as our neighborhood changes in Lake Highland. But I was just wanting, I asked the question because I didn't know if I was just my own perception or whether there was some numbers behind it. That's all.
You've just become more democratic and you notice them more.
That
Yeah.
could be.
The
That could
cost
be.
of housing is high enough to attract Republicans, I guess.
That actually was one of the things that I was wondering, because this neighborhood is going through massive change.
Yeah.
And I kind of think of it as sort of a mini Highland Park sort of thing.
Yeah.
I'm in the L Streets neighborhood and it used to be 60-40, but this past year we went over and now we're the majority party of the Lake Highlands. It's becoming more democratic. And with that, I'm going to tell you that I'm thinking about hanging up my shoes and this year, and I've got a young man that's my neighbor. He wants to do it, so I think I'm going to start introducing him around and get him up to speed. Yeah, I think it's becoming more democratic up here in Lake Highlands.
My neighborhood, I'm 2067, and when we moved here like almost 30 years ago, it was real Republican, and now the home values have really gone up, and we're getting a lot of more new young people coming in, and a lot of Democrats, and it's more Democrat than Republican. So who knows?
Yeah, a lot of people have moved from out of town, from the West Coast and the East Coast, and they're more Democratic.
Sure.
Democrats make things better. That's all there
They
is to it.
do.
Let's just hope the Republican Party keeps destroying itself with their terrible voter suppression policies, racist,
Yes.
elections and sedition, and not believing in actual voters.
And not taking the vaccine, and then
exactly.
wipe them out.
Yeah, kind of like the dinosaurs.
Yeah, exactly.
Well, I
They're
did
gonna
see,
die off, right?
they will. I did see that we do have our guests on for today. I see Dr. Philip Huang and Commissioner Theresa Daniel, and it looks like they are masked up and ready to go. So good morning. Welcome to the Lake Highlands White Rock Democrats meeting.
Well, good morning. How are you? Can you hear us?
Yes.
Okay. First of all, just wanted to say I'm Theresa Daniel, long time member. It's been Lake Highlands White Rock Dams have been around almost 40 years, which does not seem possible. But I'm here today with Dr. Philip Huang, who is the Dallas County Health and Human Services Director. All of us have been impacted by COVID. And so we're going to take a few minutes to get some answers from him. Just wanted as a little bit of introduction, county government is public health and public safety. And COVID obviously is a huge piece of what we're doing in public health right now and looking at how do we keep our community safe. Fortunately, we have a person at the helm in Dr. Huang who comes with many years of experience. He's a doctor for one thing, and secondly, has a very long experience in public health and public administration. We are at Fair Park right now and decided to sit outside, and there are the lines right behind us where he's going to move it a little bit, I think, if you can see them now, where people are coming through to get their vaccines. This has been, everybody talks about what an unusual year 2020 was with all of this, and what it did to a county like Dallas County and needing to respond to keep our community safe. So a couple of the things that are going on is periodically, every couple of days, I receive reports of the number of shots, the number of vaccines that are administered, what kinds of shots they are, whether it's Pfizer, Moderna, and now Johnson and Johnson, because it makes a difference, obviously, on what people are supposed to do. My district office, because for just luck of the Irish, we get to answer a lot of constituent questions. And so that's partially on some of the questions I'm then going to be asking of Dr. Huang, because it's just the kinds of things that people have been asking. And I hope that this also responds to some of the things that the membership of Lake Highlands has. Throughout the years, I've worked with a lot of you and really appreciate all you do year in, year out. And your interest in these kinds of topics has always been kind of the mainstay, so that we can keep abreast of how we can do a better job in our communities. Would also like to just mention that there's been an article that Dr. Huang and Dr. Theresa, who is the CEO for Parkland, jointly wrote, and I can make sure that you guys get all of this, and it's called The Imperative for Integrating Public Health and Healthcare Delivery Systems. It's a published article that kind of describes what's going on in Dallas, Texas. And I think that you also might find it kind of interesting to see how much we have used data to guide what we're doing. And when you look at where we are right now, the command center is a 25-foot double wide over here. Between FEMA, Dallas County, the Dallas Police Department, the Dallas firefighters, and so many other people, this whole enterprise gets run. Just as a side point, in that report that I mentioned that I get to take a look at, it talks about the number of people it takes to run this place. On any given day, there can be 500, 600, 700 people. Most of them are staff people, doctors, people getting shots, but they're also the fire department, the police department, FEMA, the National Guard is here helping out. And then there are volunteers of all sorts. The Baptist men are here. Kroger sends a lot of volunteers. And then just a lot of people who are willing to help out. So without further ado, if you do have further questions, I know that probably a couple of either Brian or Dale McEwen, who I see right there, are monitoring that, and we will be willing to do that. And we have probably about a half an hour here. So let me just start and we'll see where it goes. So thank you guys so very, very much for all you do to make Dallas County a more civil, a more civic-minded community with your activities. Anyway, so let's start. I have a sneaking suspicion that everybody has an awareness of what COVID-19 is. But Dr. Huang, you might want to say a word or two about your being here.
Sure. Well, it's an honor to be here. Thank you, Commissioner Daniel, and for all the group on this call, for having me. And the one thing Commissioner Daniel didn't mention is I did graduate from Lake Highlands. I grew up in the area, went to Stults Road Elementary. I actually started at Green Hill, but then went to Stults Road Elementary, Forest Meadow, and Lake Highlands. So this is home, and it's been great to be back here, and it has definitely felt like home. Big reminders of that. So yeah, Lake Highlands in particular. It's Commissioner Daniel said, this whole event has been pretty unprecedented, and we'll have a good conversation.
Well, the good news is that it has been an incredible learning experience. uh, 15 months ago, none of us had any idea of any of this stuff going on. But how does, let's get into the, what is COVID-19? How was it spread?
So, it's spread by droplets, but it's been when people cough and talk, can also be on surfaces. People get it and then, touch on their hands, touch their eyes and other membranes. But it's also, because it's so transmissible, it is, still learning more about how much in terms of how long it sort of persists in the air with those really small droplets, things like that. But it's similar to other droplet spread diseases. So that's why the masks and things are really important.
Well, that's obviously the next question. So is there a way to prevent this? Or
yeah, it's all the things that we've been recommending. I think we've continued to learn throughout this more and more. The masks have become increasingly recognized as an important way to slow down the spread. And so again, avoiding crowds, staying 6 feet apart at least, washing hands, all of those things are important and remain important in slowing the spread of this. And then the vaccine is another way that
we'll get into that. What happens if I get sick? What should I do?
If you've been exposed and think you might have COVID and are having symptoms, talk to your doctor. Tell them first. There's a lot of testing sites that you can get tested. If you're confirmed as having COVID, then if you're not severely ill, then you really need to isolate and not be exposing other people during the period of communicability. That's now, again, if you have a uncomplicated course, that can be 10 days up to 10 days after the start of your symptoms. Now, you do need to be monitoring all the time if you start to have difficulty breathing, other problems that you need to maybe seek more severe sort of care. But if it's a milder case, you want to make sure and isolate. And then also, then our staff at the health department should be following up and trying to identify any contacts that you may have had during that period of communicability. Or if you can notify, if you know people that you've had as close contacts while you were possibly transmitting it, that to notify them to be watching that and try to avoid being around other people and possibly exposing it.
I can tell that you've gone through this once or twice before.
Yeah.
Because you've already answered the next couple of questions.
Sorry.
No, not a problem, which is, what do you do if you have more warning symptoms, and what happens if you come into contact with somebody? Let's talk a little bit about the vaccines. A lot of the calls that I get from constituents are a little confused about, first of all, the types of vaccines that are available, and then how do people get registered?
Sure. So anyone is maybe there are now 3 vaccines that are approved under the emergency use authorization by the FDA: the Pfizer, the Moderna, and then the Johnson & Johnson. And they're all, really scientific, great scientific achievements. Pfizer and Moderna are, these new mRNA sort of vaccines. It's not like, it tricks the body into producing that spike protein that you see on the pictures of coronavirus. There's little things coming out of it. And so the body then develops its own immune system to that. And similarly, it's a slightly different way that mRNA is, and the spike protein is tricked into being produced, but that's similar to the Johnson & Johnson, slightly different way of doing that. But none of them are like the actual coronavirus that can't cause coronavirus illness or anything, but they do get the body to produce antibodies and an immune response to that spike protein.
Okay. The first step in the community health aspect of this is to register people to get the vaccine. What do you recommend people do for that?
So yeah, we really want everyone really to be register on our county website. It's off of dallascounty.org and get into the system because that's where we have been pulling the names and people to offer appointments to get the vaccine. You can also sign up on other websites. You know, there's other Tarrant and Denton and Colin, I think have sign ups. But sign up on the Dallas County website, and that's how you can then be notified when we get appointments available.
Step 2 then is, how do you get vaccinated? What happens after you register?
So when you're at the appropriate risk, so we're going from the highest risk groups, and as the state, working with the state and the federal guidance, because there's still limited vaccine available. The initial vaccine was made to those that were the highest risk for severe illness, hospitalizations, and death. We started out with persons 75 years and older, then went to 65 years and older, and then people who are younger but then have underlying medical conditions. It was recently opened up also to school teachers, and then now 50 and older. So then if you're in those categories, and when we have available vaccine, we try to send out appointment notifications and text or emails, and people can also, we're also doing some community signups to get people appointments if they don't have access to the technology. And then they'll complete some questions and get a little QR code with an appointment time to come into Fair Park is how we're doing it here. We're also partnering with City of Grand Prairie, City of Irving that has a drive-through. Also Forefront Living Hospice, which is right here, Central and Forest Lane, which is a really nice place. And they're doing about 1,000 shots a week. Multiple sites that are trying to work off that waiting list to get people appointments.
Are there any?
My card, or you guys need it? Or are you gonna be 4 minutes? I wait.
We'll be done in 5, 6, 7 minutes.
Okay.
Thank you, ma'am. Thank you, ma'am. Okay, so then the people after registering will be informed of where of the when and the how they get the vaccination. Are there any side effects of the vaccination?
The main side effects, there's local pain where you get the injection, redness. You can get some chills, fever, body aches. The severe side effects that we're really concerned about that is very rare, but severe allergic reaction where you need like an EpiPen or something. But that's very rare. But otherwise, it's lasts maybe about a day or so.
Thank you. How long do I have to wait after testing positive to get vaccinated?
After you test positive, the main issue we worry about, if you have active illness, we don't want you infecting people who are giving the vaccine. So during that period where you need to isolate, you need to then stay home for that period, probably at least 10 days after the start of your symptoms. But we do also think that you're protected for at least 90 days after you get infection, natural infection. So you don't have to get vaccinated immediately. You would have some protection for about 90 days, but you're certainly welcome to get the vaccine anytime before the 90 days, but just after that infection period.
Speaking of testing, should we still get tested?
If someone has symptoms that are compatible, certainly if you've been exposed to a known case, then getting tested is a way to confirm whether you have COVID versus something else.
And I assume you go to dallascounty.org to find out the locations and the hours of testing, right?
There's a lot of places, 2 places that are have been up for testing sites for quite some time. Ellis Davis Fieldhouse, Eastfield College are still going on, operating in Parkland, and they're also offering vaccines there. But then there are many other sites now that are offering testing also. So there's a lot of ways you can probably get tested.
One of the other parts of this that we have done, Dallas County's done for years, related to other communicable diseases such as STDs and HIV, et cetera, is tracing. Is tracing being done for COVID?
Yes, we've been doing contact tracing since the start. It is something that we do, as you mentioned, in public health for several other conditions. But it's, doing those interviews with people who test positive and identifying the people who've been in close contact that may be able to spread it to others, trying to notify them to try to stay quarantined and not infect other people.
One of the questions we get asked a lot are, can your pets infect you in any way? Is that something that can happen?
There's not really, thought we can continue to learn more about that, but that the pets can infect you. Now, some of the pets can get infected, or there have been some cases, few isolated cases, where like cats and other animals have gotten infected, but it's not identified that you can really get it from the pets.
Well, that's good to hear.
Although they still say you can sort of treat, state, if you're infected and things, treat your pets like that same distance.
So limit your contact there, isn't it? The other. We answer a lot of questions about misunderstandings, rumors, myths about COVID or about getting a vaccination, so that there's a hesitancy about getting a vaccination. What are your more frequent questions that you answer related to myths or untruths?
So there is still a lot of misinformation and lack of information about the vaccine. People are worried about that it was rushed and that all the the safety things weren't followed, but they did actually go through all the safety steps. There weren't any real shortcuts that were been done with this. It's been tested, it's being monitored for any side effects, and it's this evidence shows that it is safe and effective. And so that's one of the questions that people come up with. There's also some crazy stuff like some people hear that you're injecting things to track people or monitor them. With some communities, there's a lot of distrust just because of some historical, horrible things that have happened in the past. Certainly with prior things like the Tuskegee syphilis studies. But this is nothing like that. It is safe. Again, some people, I know some of the undocumented persons are concerned that we're going to use, collect information and find out their status. That's not used for any of those purposes. So those are a few of the questions and concerns that we hear about.
Yeah, I know we've heard them all. There's no doubt about that. A couple of the things going on is that Dallas County and a lot of groups are very active in registering people in order to make that first step to get a vaccination. And what I'd like to do is contact, talk to the folks at Lake Highlands, White Rock Dams, and see if you would help me either do a drive-through registration or to go in some of the harder to reach neighborhoods and really talk to people in order to register them. So can I do that with you guys? I hope so.
Absolutely.
But I'll be following up with that. So are there any other questions for Dr. Huang? He's got just a couple more minutes.
Yeah, Commissioner Daniel, we do have a few questions that were in the chat, and I'll try to consolidate a few of them. One of the questions was approximately how many vaccines are given daily at Fair Park? And also, with the 3 different vaccines available, which one are you best getting?
We've given up to almost close to 10,000 in a single day. Right now our limitation is the availability of vaccine. We could do over that. We could do more than that. Again, we had we've been getting over 1,100 per hour that we see here. So we easily could do 11,000 a day, but our biggest limitation is the availability of vaccine. Right now, all of the vaccines, the Moderna, the Pfizer, the Johnson & Johnson, they're great vaccines. We recommend anyone to get the first vaccine that becomes available to them. They are all really good, and the Johnson & Johnson is a one-shot vaccine, so you just get that one shot and you're done. So there are, but they all have, they're quite effective.
That's in Dallas County per se is not the only location that is providing the vaccines. Is that true?
Right. There are other places. Some of them, we're partnering with others. As I mentioned, City of Grand Prairie, City of Irving, Forefront Living Hospice, but also City of Dallas has a site at Potter's House. Parkland is doing some, UT Southwestern. So there are several sites, and then Tarrant County, Denton County, Collin County.
So the number of Dallas County is doing about 8, 9, 10,000 a day, but there are a number of other places in Dallas County, so our numbers overall are higher. Any other questions?
Yeah, another question that was asked is, will the vaccines affect a woman's ability to get pregnant, or are there any complications that have been seen with women and their fetuses?
No, there's actually, been some misinformation that's been out in social media about that. And so the science has, shown that is not, there were some, again, misinformation put out there, but it is not a issue that is valid.
Okay, so if you are pregnant, it's okay to get the vaccine?
That's something still to talk to your physician.
Sure.
To make sure there's no other concerns. But yeah, it is, pregnant women are, yes, able to get the vaccine.
Okay. And for those people that are getting vaccinated today, right behind you, and those that have received their first shot, what is the awareness system to let them know when to come back for their second, and how long will the Fair Park immunization area be open so people can get their second shot?
Sure. And that's been a question, and it's been a little, in various places, some pharmacies now are also getting more vaccine availability, as I think F2HCs, that are qualified community health centers. And at some point there was some, we were hearing from people, they were saying they went to a pharmacy, got their first shot, and then the pharmacies weren't sure if they were going to get the second shot. We've worked with the pharmacies, we've worked with the state. Everyone who gets the allocation for the first shot will get allocations for the second shot. So you should be able to go to the place where you got your first shot to get your second shot. The timing on that for the Pfizer, it's 21 days after your first shot. For the Moderna, it's 28 days after the first shot. Here we tell people what that 21 or 28 days is, and tell people try to come back on that day and around the same time of day. Now, this next week is the first week we're sort of mixing that up a little, because we have now all 3 vaccines, and we're trying to make sure that availability and supply of those are a little, they come available on different days. So we are going to be changing that and sending out more information to the people who received their first dose. So it's for second shots. Next week, it's going to be Moderna on Mondays and Fridays, as well as the first shot of doses are available Mondays and Fridays. Tuesday, Wednesday, and Thursdays are going to be second doses for Pfizer. So that's something, the default is for people to come back either 21 days or 28 days, depending on which vaccine they received, and about the same time of day that they got their first dose, between 8 and 5 p.m. But again, there's some changes that are going to be coming up with that we're going to try to get the messaging out. But it's because of some of the availability of the vaccines now and the complications that are with them.
Is that information going to be online?
It is on the website. It is on the website. But now there is, CDC also did relax that it's not like we want people, and for scheduling, it's easier if people will come back on that 21 or 28 days, so everyone doesn't come on the same day. But there is, if you miss that day, you know, CDC says you can, the data still show even up to 42 days after that first shot, you're fine. The recommendation, if you miss even that 42 days, we'll give it to you, but we know that within that 42 days, it still has that same effect.
What about in-person events? I know that, you know, the CDC just revised their guidelines for schools saying 3 feet is okay in classrooms. A lot of people have been vaccinated with 1 or 2 shots. What are we looking at in the future in terms of Dallas County and when we can start gathering in person? And when do you think recommendations for that will be coming out?
CDC also updated their guidance on what fully vaccinated people can do. And fully vaccinated means like 2 weeks after you've completed the full course. So don't just, you know, you get your first shot, and you get your second shot, and they go on fine. It's then 2 weeks after that last dose. So for Johnson & Johnson, it's only that 1 dose 2 weeks later. For Pfizer and Moderna, it's 2 weeks after the second shot. But CDC has given guidance on what fully vaccinated people can do, and it's mainly, it does relax it for if you're with other people who are fully vaccinated, then indoors you can relax the masking and the physical distancing, or if you're with one other household, limited household, you can relax that, as long as none of the people are at the high risk groups, like older persons or those with underlying medical conditions. But still, the guidance is not, it doesn't then open it up for medium or large gatherings. Also, we have a public health advisory committee of local experts that have been looking at our local situation. You know, we've been in the red zone up till now. There was a period we went to orange. So we still don't recommend, you know, the gatherings. And you know, the CDC recommendations are also, if you're still out there in the public, or to still use the mask, still 6 foot physically distance, still avoid crowds, all of those things. And so probably next week, our local guidance, we probably will be moving to orange pretty soon. But still, you know, it's not a time to relax and think everything's back to normal.
So we have a club picnic in May, on May 15th, that we'd love for both of you to attend. We did it virtually last year, and Scott Hadden pulled off a wonderful event with hundreds of people watching online and so forth. If you could put on your event planning hat for May 15th of 2021, do you think that the Lake Highlands White Rock Democrats should get together in an outdoor forum at Flagpole Hill? Does that sound like a good idea with social distancing and masks?
How many people usually show up?
100 or so.
How many?
Probably 100, 150 maybe.
Yeah, I mean, you know, we'll see how things are. You know, we are still very concerned about the variant strains that are circulating. Outdoors is definitely better than indoors. And with anything, you know, we recommend staying the 6 foot physically distant. And, you know, again, it's, if people are fully vaccinated, then there's some relaxing that, you know, in smaller settings. When you got a mix of people, that makes, you know, it's hard to tell exactly where we'll be in May.
Okay. And do you expect, I know that the Biden administration put out guidance that they wanted every state to release all categories by May 1st. Is Dallas County kind of moving in that direction to allow young people like me to get vaccinated?
Yeah, we want everyone to get vaccinated as soon as possible, and recognize there are a lot of priority groups that need to be vaccinated. It all depends on the availability of vaccine, and if they get us the vaccine, as we said, we've got more capacity here. We could be vaccinating more people if we get the vaccine. And if that vaccine starts flowing, then we, you know, absolutely, we could get there.
I just wanted to make a comment here too, that this is decision making based on the science of what we're learning, both, you know, across the country, around the world, on what are better ways to address the situation, because people are still dying even here in Dallas County. So there's, you know, a need to continually be aware and to bring that information in. As Dr. Huang said, today we're still at red, which is very limited social interaction. And maybe watching the numbers decrease in positives and the impact on people, maybe we can be moving to orange in the not too distant future. So we're looking forward to that. Any other questions?
I don't see any others in the chat. I did have one that's been on my mind about the vaccination, and not just this year, but what the future looks like. Will this be a vaccine similar to the flu vaccine that we'll need to take on an annual basis?
So that's something where we still don't know exactly how long, the effects will last, and how the variants will play into this. So it's still, it may become something like that. That's quite possible, but we don't know for sure yet.
Well, first, I just wanted to say thank you to all, to Brian and to all the folks involved with the Lake Highlands White Rock Dams in your interest and your willingness to get out there and do something about issues in our community. And Dr. Huang, thank you so much for taking time out of your schedule. As you can tell, it's a Saturday morning. Things are happening here. There's been busloads of people coming in from parking areas. So if there aren't any more questions, we'll say thank you very much and bye-bye. Let me know if there's anything else we can be doing, or always happy to, if you want to send questions in to answer them.
Great, thank you both. And we'll keep an eye out for the guidance from the county and see what we can do about getting together in person for that picnic later this year. But I think Dr. Huang and Commissioner Daniel both said the right thing, that we need to look at science, and just because we want to get together in person doesn't mean everyone should. So we'll be looking to that. So thank you for being on today, and also we will follow up with you on doing a drive-through registration clinic, so we can make sure that everyone in Lake Highlands who doesn't have access to the internet and so forth can get signed up and get that important vaccine.
Yeah. We'll be talking about some of those things. Thanks an awful lot, Brian.
Thank you.
Great. Thank you.
Bye-bye.
Wildcats. All right. Well, that was awesome. We got to take a look at the actual Fair Park vaccination area. I know some of us have been there to get vaccinated or to volunteer. But this kind of moves us into our club meeting portion of the day, of the morning. So I kind of gave somewhat of the president's report earlier, mentioning that Vice President Terry Hodge has stepped down due to some other obligations. So we'll get to that in new business to talk about nominating a new vice president. For Terry's report, or the vice president report, I'll just give that right now. Our next program is kind of exciting, and Representative Hodge did set this up for us, so we want to definitely say thank you for doing that. It's going to be with Dallas County Tax Assessor John Ames, and also kind of one of the key people over at the Dallas County Central Appraisal District, Cheryl Jordan. And so the topic's going to be Dallas County taxes and the property appraisal process. I know a lot of us see our property tax bills and are just amazed by how it goes up, and what's happening with the appreciation of real estate in Lake Highlands and around Texas. And there's been some legislation, I think in the last session, that capped the increase, but it's always a topic of interest to members, and we thought that that would be a good topic. So that'll be April 17th. And then in May, we're going to be trying to do our picnic May 15th. So that'll be the next programming part to what the vice president's working on. So if you remember last year, we did it virtually. It was really fun. We had a lot of great musical acts, had a lot of great candidates. So we kind of hope to replicate that, but get back to possibly doing that in person. But we'll be taking the guidance of the county and, kind of just hearing some feedback on that. So moving on through the reports, Tim, who is our treasurer, is actually out today. He's in, I believe, San Diego, and enjoying some time with his family. So we don't have a treasurer report today. Dale, can you give us a PAC treasurer report and how we are there?
Sure. We filed a PAC report once a month. We did that March 5th. Next one is April 5th. Every contribution and expense of the club gets reported to the Texas Ethics Commission, and we have made our deadline every month, so we're good.
Good. Thank you, Dale. You know, and just a reminder, you know, we do function as a PAC, so that way we can donate money to mostly the Dallas County Party. We've made a decision, you know, over the years to not donate to individual campaigns, but that doesn't mean we can't do that in the future. And I'm going to post in the chat just a reminder for membership. So if you need to update your membership, you can do that. And on that note, we will hear from Judy Garrett, who is our membership chair. Judy, how are we doing on members?
Yes, we've had several people pay membership. We've also sold some more T-shirts, which I got delivered. I actually delivered one to Theresa Daniel, and we had another gentleman that I delivered to this week. So we're up to date on deliveries for T-shirts. Brian, thank you for putting in the next order, because I do have several more people in a waiting mode at this point for different sizes that we didn't have. I am anxious. Hopefully, if we do our picnic, we can do a display of some of our items, including the T-shirts that we may be able to sell. I think we'll do well if we can display those in person. Like I say, membership, I have continued to clean and cleanse. Several have been deleted. They were former candidates and things like that. But otherwise, we've had people continuing to pay. We've also got some, several people that I've talked to recently that want to be involved in our club. So I think it's everybody's got their fingers crossed that we get some in-person things going on in the near future, and that's certainly going to help, I think. Otherwise, that's where we stand. We're hanging in around there, around the 220 mark at this point, but it may come down a little bit, may go up a little bit. It's staying about steady.
Great. Thank you, Judy. And just a reminder, the memberships do run on an annual basis. So if you sign up in January, that takes you through the year. If you signed up in 2020, and the fun year that was, your membership would have lapsed. So we do give kind of a grace period from like October, November, and December. So if you did sign up in 2020 in October, November, December, we do carry that through the next year. So we do have our chili supper this year, which will be in October, and we hope to do that in person also. And that'll be at the Winfrey Point, from what our plan is. So looking forward to seeing everyone in person, and you can always pay by check, if you want to make that drop a check off, or hope to see you at an event soon. Moving on through the reports, we do have a secretary report from Rhonda, and I'm going to post the minutes, the unofficial minutes, into the chat so we can take a look at those. So Rhonda, take it away.
I don't have a report other than that you're posting the minutes, and they also, I believe, were posted on the club website as well.
Yes.
Thank you, Brian.
I'm going to post those in the chat. And what we like to do is just to make sure everyone gets a chance to, see what happened in the last meeting. If you can take a look at those, we'll do a vote by affirmation to accept the minutes as official. So I posted those in the chat if you want to take a look at those for a moment or two. One of our goals, at this part of the meeting is just to make sure that all the members are aware of what's happening and the decisions being made. So we also post the executive meetings as well, which will second those and get those official at our executive meeting on the 22nd. So if you've had a chance to look at the minutes from our last general meeting, I will entertain a motion to accept those.
So moved.
Do we have a second?
Elise did.
Okay. We have a second. All in favor to approve the minutes as they stand, say aye.
Aye.
Any opposed? All right, we'll enter those records as official into our report and post those on the website. Moving on.
You might also mention that the club donated, some club members donated money on behalf of Sally White to Planned Parenthood, and Ms. Crabtree, I think, to CC Young, 2 members of our club who died in the last 2 months. So contributions were made by the treasurer to those charities.
Yes, thank you, Dale, for mentioning that. Yeah, we did have a number of members send in donations, and those did go to the final wishes of Vernie Crabtree and Sally White. So thanks to everyone that donated to that. It's always tough when you lose, good members and good members' families. So hopefully we won't have to be doing very much of that in this next year. So do we have any old business to consider? I didn't have any on the agenda. No old business. We'll move on to new business, which this is kind of the fun part. So under new business, we do want to accept nominations at this point for club vice president. As I mentioned earlier, we did have Terry Hodge step down and we had a vacancy. So we do like to have a formal process where we accept nominations from the floor. And that way, if anyone, does want to be considered for vice president, we do entertain that. And so at this point, I will call for nominations from the floor for vice president.
I nominate Kendall Scudder.
Okay. We have one nomination for Kendall Scudder.
And I second that, and Scott Hayden also seconded that. So.
Okay. So we have a nomination that's been put on the floor and seconded for Kendall Scudder. We'll consider that in a moment. Do we have any other nominations for vice president? And Tim's going to remind me in my head that we have to ask 3 times. Are there any other nominations for vice president? Okay. Hearing none, we're going to consider the nomination of Kendall Scudder. And Kendall, I saw that you joined the meeting, which thank you. I know you have a meeting that's also adjacent to this. Would you like to say something for a few minutes and just kind of let the club know a little bit more about yourself and so forth before we vote? And just for the record, I've spoken with Kendall. I'm very excited about it. So Kendall's definitely got my vote, not to influence anyone. But Kendall, tell us a little bit more about yourself.
Thank you, Mr. President. I appreciate you. My name is Kendall Scudder, and the meeting Brian was referring to is there is a State Democratic Executive Committee meeting happening right now, and I serve on that body for Senate District 2, and so I'm bouncing back and forth. Today's budget day, so I've been doing a lot of work for the Texas Democratic Party's finance plan for the next year. But I just really appreciate y'all for including me in this. I live in the neighborhood and am always happy to help out whenever I have the bandwidth or the ability to do that. I was sad to hear that Terry had to step down, but I'm happy to fill those shoes as best as I can throughout the rest of the year. If anybody has any ideas or things that they'd like to see, reach out, let me know. I'd absolutely love to hear from you there. I guess I was supposed to tell you a little about myself. So I've worked on just about every level of Democratic politics you can imagine these days. Been doing it for about 18 years now. I've been a president of a local club. I've been a county chair. I've been a precinct chair. I've been on the SDEC. I was nominated for the state Senate back in 2018. I've been a candidate for nonpartisan office. And so I've definitely run the gauntlet in Democratic politics, and it's kind of defined my life's work. And so I would, it'd be a great honor to have the opportunity to serve this this club and my community over the next few months, and I appreciate y'all's consideration.
Great. Thanks, Kendall. And just to give everyone a reminder of what the vice president does is they basically help to arrange the educational programming and the forums and the club meeting. So, you know, with Kendall's connections and his podcast and his previous experience, got just a lot of great connections. So I think he could continue the wonderful work that our vice presidents in the past have done. So on that note, since we do have a seconded motion for Kendall Scudder for vice president, and we've called 3 times for vice presidents with no other nominees, I would like to get a vote by affirmation on Kendall Scudder as vice president for 2021 of the Lake Highlands White Rock Democrats. All in favor, say aye.
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 Any opposed? All right. Well, let's say congratulations to our new vice president, Kendall Scudder.
Thanks, you guys. I appreciate you.
All right. Now for the fun part, Kendall, we're going to put you on the spot here and let you actually be sworn in. Yeah, there you go. So would one of our board members help me with the swearing in? I can post that in the chat if that helps. Or our secretary, could you help with this, Rhonda?
I have a copy of that, but it'll take me a minute to find it.
I've got a copy here too. I can post it in the chat if you could see it.
I can't see that.
Okay.
So I don't think I can assist in the swearing in. I'm sorry.
Okay. Well, I'm happy to help with that. So Kendall Scudder, repeat after me. I state your name.
I, Kendall Scudder,
Do solemnly swear or affirm that I will do to the best of my ability.
do solemnly swear or affirm that I will do to the best of my ability.
Faithfully execute the duties of the office of.
Faithfully execute the duties of the office of.
State your position.
Vice President.
Of the Lake Highlands White Rock Area Democrats.
Of the Lake Highlands White Rock Area Democrats.
As stated in the Lake Highlands White Rock Area Democrats.
As stated in the Lake Highlands White Rock Area Democrats.
Bylaws.
And
will support and uphold the rules. Of the Democratic Party of Texas. This next part is optional. It says optional. So help me God. All right. Well, congratulations, Kendall.
I appreciate y'all. Thank you.
Thank you very much. Well, this is exciting. I'm excited to work with Kendall and the executive team to create some great programs throughout the rest of the year. We do have the picnic coming up in May. If anyone would like to help out with that, you know, we're always looking for help with putting the picnic together. Let us know. Or if you have programming ideas, you know, Kendall's the man now, so you can send him your ideas. I know that in the survey of members, education was a big part of it. Just wanting to learn more about, you know, things and the Democratic Party, how things work, what we can do to elect more Democrats and so forth. So send him your ideas.
Frequently, Kendall, we have the candidates, if they've announced for the next primary, we have them come and introduce themselves. So that's a possible thing you might want to consider.
Okay, awesome. I have some ideas for what I'd like to start planning for the next one, which I think is in June that I'm needing to plan. So definitely looking forward to some input there, and hopefully we can get some rock stars to come in. It'll be fun.
Yeah, definitely. Well, great. Well, that was our new business for the day. the next item on the agenda is announcements. Do any club members have announcements on things that other members should know or that we need to be aware of?
I just want to remind everyone we have a city council and school board race coming up May 1st. And so I'm guessing that we're going to need clerks to work those elections. So if you're not a precinct chair and you can work, you might let your precinct chair know you're available. With all the to-do about whether people have to show up to vote and all that, and early vote. And, we'll be doing an election during COVID time. So everybody needs to be aware of that and whatever precautions. I'm sure the county will provide the same kind of protective equipment they did the last election in before November and the runoff. So, but that is May 1st, and early voting starts in April 19th to April 27th.
Okay, thanks, Dale. And that reminds me that we will be working with the feds to do some lit sticking, just to remind people of the early election dates and the election day, just to make sure we can get some Democrats out there, even though it's a nonpartisan race. And also, I do want to give Al Ortiz a chance to tell us about the lake cleanup and how the lake's looking. I know I sometimes forget to mention Al, and we do have a spot at White Rock Lake for cleanup. Al, how are we doing with the lake cleanup?
Well, not too good right now because of the winter weather, but it looks like that maybe we're over that, and so we might have some nice weather from the next few months. Just want to remind everyone to get your garbage bag or meet me there at 8:30. Our position on the lake to clean up is from the bathhouse to the old, where used to be the Dreyfus Club. And I'll have the material there. I usually go the second Saturday of each month. So meet me there and we'll help clean up the lake and do our duty. And it probably needs it pretty good right now. So see you out there.
Where exactly at the bathhouse do you meet? Like behind the bathhouse?
In the parking lot.
Parking lot? Okay.
Yep. Closest to the what I consider the south side of the bathhouse. But
yeah, I saw, Elise, that you were out with the feds the other day.
Yeah, yeah.
Found some good stuff.
We met at Winfrey Point, and I found some good stuff. I found a big boot and a shoe and a bunch of plastic bottles, and this was the most fun thing I found. I don't know if you can see it. It's a replica of a penny.
Yeah.
In plastic. But so I'm always finding pennies, but I've never found one that big before. Anyway, yeah, there wasn't a heck of a lot of trash over there, but we were over walking our dog closer to the bathhouse the other day, and there was more, and I wish I had had a bag with me. So yeah, I'd like to come out and help.
Great, thank you. And if you are a pool owner and you have old pool nets, those are great for the cleanup as well. I've done some with the Boy Scouts before, and they use the long, ones to get out there and get all the plastics. So definitely thank you for helping with that. And it's a beautiful day. I might head out there later just to get some exercise. Do we have any other announcements? Well, I see that Charles dropped off, but it is exciting that we do have a person in the CD5 congressional race. So I think that the more we can do to support the candidates that are running against areas that have been gerrymandered for so long will definitely help us. So I look forward to supporting that candidacy and looking to see where that goes. So if there are no other announcements, I will call for a motion to adjourn the meeting today.
So moved.
Second,
All right, it's been motioned and seconded. All in favor of adjourning the meeting for today, say aye.
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 Any opposed? All right, well, meeting adjourned at 11:13 on Saturday, March 20th. Thanks everyone for participating, and I'll work with Commissioner Daniel to get a little more information about the drive-through registration and let you know what you can do to help with that. And have a good rest of the weekend, and hopefully we'll see you in person soon.
Thanks, Brian.
All right,
Thank you.
Yeah.
bye everyone,
Bye.
Bye.
and congratulations, Kendall.
Yes, Kendall.